Okay, today I'm here with
Meg.
and today we're gonna do the first exercise of our routine, and that is the wall slides. So what we're gonna do, this is the first exercise in our progression. The supine wall slide is a passive range of motion exercise that will be used for knee rehab after an injury or surgery.
This exercise is performed with the patient lying on their back. The patient's leg with the injured knee is extended on the wall at a 135-degree angle with their other leg resting on the table or floor. The patient will begin to slide their foot downward to a 90-degree angle. Gravity will help assist in this flexion.
Okay, so Meg, what you're gonna do is I want you to lay on the ground right here. Keep your right leg down on the ground. Yep, push right up against the wall. And then put your left leg up all the way to the top of the wall. Almost, yep. Yep, right there. But remember to have a little bit of bend in your knee. Your knee, because a common mistake with this is that you will straighten your knee all the way and put it into full extension when you can't. You shouldn't really be doing that. This exercise is important because it works to increase knee flexion and reduce stiffness in the knee, and supine wall slides allow also for controlled stretching without any excessive strain. Improving knee flexion will help in lots of daily activities like walking, going up and down stairs, and squatting movements, to name a few. You want to be able to walk up and down the stairs, right, Meg? Yeah, you do. All right, so Meg, what you're gonna do is you're gonna let your left foot slide down the wall till it gets to perpendicular right there. And now you're gonna use your right leg to push it back up to almost fully extended. Yeah, there you go. Now this time do that again, but keep your left foot on the wall and go just a little slower. Good, good. And now slide it up with your right foot. Okay, the primary joint movements that are involved in this exercise are knee flexion and extension. The secondary joint movement is hip movement, but this is very minimal. The supine wall slide takes place in the sagittal plane of motion, and the prime movers for this exercise are knee flexion for the hamstring muscle and knee extension for the quadricep muscles. The antagonists are knee flexion in the quadriceps and knee flexion in the hamstrings. The stabilizers are the hip flexors, which assist Meg here in leg control, and the core muscles, like your rectus abdominis and your transverse abdominis. Where your abs at, Meg?
Right here.
Yeah, there you go. And when she's in knee flexion, the hamstrings contract concentrically and move left on the LTR curve. And while this is happening, the quads contract eccentrically, moving right on the LTR curve. In extension, the muscle groups would switch roles, with the hamstrings contracting eccentrically and the quads contracting concentrically.
The typical range of motion for the supine wall slide is from 135 degrees, which is full extension, to 90 degrees, which is full flexion.
So Meg, show me full extension. Put your leg all the way up.
Like that?
And then bend just a little. There you go. And then show me full flexion, which is when you bring your knee down. Yeah, there you go. Beautiful, beautiful. There are 3 types of muscle contractions used in this exercise. First, the extension muscle contractions take place when the quads are controlling the descent as the knee flexes. So put your leg back up at the top and then descend, bring it down the wall. Yeah, there you go. There you go. Secondly, the concentric muscle contraction takes place when the quads contract to straighten the knee and return the leg to the starting position. So now use your left leg to assist you a little bit and push it back up. There you go, there you go. Lastly, the core and hip stabilizers contract isometrically to keep the body stable during the movement. Obviously, we already went over a common mistake, which is not keeping your knee bent during most of the exercises. But you also need to make sure your back is flat on the ground, which Meg has done a great job of. You should be using controlled and slow movements the whole time, just because this is an exercise to increase range of motion and not have excess pain. You should know your limits and not overexert yourself, because this could lead to further knee damage. And get total knee flexion comfortably, you can use ankle weights to keep this exercise to condition your range of motion. You have to stay consistent with this exercise for the best results. Probably would recommend doing around 20 reps on each leg. Meg, how do you feel after that?
Good.
Hey, if someone asks you for information on this exercise, Meg, send them our way and wall slide it over to them. Rate that joke out of 10.
Like an 8.
Okay, that's good. Thank you for your service, Meg.
You're welcome.